Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. In the studio with us today is Dr. Stephen Wojdyla of the Lima Dental Associates. Good morning to you, sir.
Morning, George. Great to be back.
Well, thank you. By the way, I understand today you want to discuss implants.
Dental implants. They're such a fantastic advance in dentistry, and it's one of the only ways to replace a missing tooth in terms of replacing the entire tooth. Mm-hmm. Traditionally, in the past, we've only replaced the crown or biting surface of the tooth. In doing implants, you replace the root and crown of the tooth. It's just like having your natural tooth back.
How long do implants last?
They're meant to last for a lifetime. Of course, you have to take care of them just like you would your natural teeth.
Okay. What's the process for placing an implant?
For placing implants, there's basically two phases. The first phase is surgical, where we place the titanium screw into the bone, and then that heals for a period of time. The second phase is restorative, where we put a crown on top of the tooth. And one of the advantages is that you don't have to make adjustments on the teeth surrounding that missing space.
Okay. This takes a while, though. It's not just a one-time thing.
No, it's not an overnight thing. It's not like putting a coin in the Pepsi machine and getting the soda out right there on the spot. A lot of times patients don't quite understand that it is a process. Mm-hmm. Surgical phase is done over about 1 or 2 hours. Sometimes we can provide IV sedation for our anxious patients, but it's not always necessary. And then that has to go through a stage of healing for about 3 to 4 months. Mm-hmm. After that, we'll place the crown on it.
Okay, so it does take quite a while.
6 to 8 months probably altogether.
Okay, good. And what are the advantages of having an implant?
The advantages, like I just mentioned, you don't have to adjust the adjacent or next door neighbor teeth. Mm-hmm. They restore the entire portion of the tooth, not just the crown, biting surface. They're fantastic in terms of comfort and in cosmetics. Okay.
You bring people in to talk to them, and you usually say, you want to consider an implant, or do they come in saying, I want an implant?
It's kind of 50-50.
Yeah. Okay, very good. And the advantages, as you say, is that it does not affect the other teeth.
Yes.
Okay, that's very good. Always great information for the people they want to know. All they got to do is call or come by and write and see you on it.
That's right.
And any final words?
As always, keep smiling, sharing, and caring.
Thank you very much, Doctor.